Hello everyone, welcome to Dr. Chan's Medical Ailments Forum today. So earlier on in the video we talked about the management of choking in particular in infants. So now I'm going to carry on from that theme, but going to talk about how to do CPR in infants in particular, but it's very similar in children as well. So just going back to the previous video, we talked about effective and ineffective coughing. So if the baby is not coughing effectively, or in fact the baby has gone into kind of like a unconscious kind of state, then you need to kind of think about doing CPR. Now infant CPR and children CPR are slightly different to the adult ones. The most important thing is if you do see a child who's struggling to breathe that might need CPR, it's much better to do it in a familiar way that you know. For example, the adult CPR, which is 30 chest compression and 2 breaths. Although this is not the pediatric version of it, it's much better for you to provide that than not provide anything at all just because you don't know the pediatric CPR. Okay, so let's go through the pediatric one. Most important thing before you do any CPR, any resus, is to make sure that you're safe. Because there's no point doing anything if you are not safe, you injured yourself, then you can't help the baby, you can't help yourself either, you might cause more problem. So make sure you kind of look around your surrounding and make sure that you are safe to approach the child to do any intervention. So number one thing is to make sure the baby is actually conscious or not. So this is the baby, so you might just gently shake the baby and say, hello, can you hear me? Are you alright? Obviously not, shaking it too hard, but just moving it around, moving the arms and see if there's any response. If there's no response, and then you need to kind of think about airway, breathing and circulation. So airway in a baby is slightly different to adults because in the adult version of basic life support, you need to do the head tilt and chin lift in order to open up the airway. In a baby, it's slightly different. You need to make sure that the head is horizontal. It's easier if I stand up to show you. Rather than tilting the head backwards, that might actually obstruct the airway even more. You want to make sure that they're lying flat on a hard surface and the neck is kind of straight in neutral position. Airway is basically making sure that they've got enough air to go in and got enough space for the air to go in. So you don't do the head tilt, but you do the chin lift. When you do the chin lift, it actually means pushing the chin a bit forward, lifting it forward so you can actually create a space for the air to go in. At that time, you will also monitor, spend no more than 10 seconds to have a look, see the chest if it's going up and down, is the air going through, or can you hear any breathing. So if you're sure there's nothing, no breathing at all and no response, you might want to, number one, shout for help if you're not on your own. And then you do the open airway, and if the baby is not breathing properly, you give 5 rescue breaths. Now this is the bit that's slightly different to the adult CPR because we don't do the extra 5 breaths, but we do it in children. One thing that you need to pay attention is if you watch movies, they do CPR by just mouth to mouth. While babies are much smaller, and you want to ensure that the air goes into the lung properly. So you need to make sure your lips are sealing the whole area, including the nose and the mouth. Okay, it's difficult for me to try it on this baby, but just make sure when you do it, your mouth is covering the whole nose and mouth. And if the baby or the child is slightly bigger and you can't actually cover the whole area, the nose and the mouth by your lips, then you might want to just go for the nose and make sure the mouth is closed so the air doesn't come back out. Okay, and you do 5 breaths. And when you do it, don't push it too hard because the lungs are not that big. So just when you blow it, you make sure that the chest rises a little bit, and then give it time for the air to come out first. Then you do another one, and so on and so forth. You do it 5 times. Okay. After that, if there's still no sign of life, then you might want to do 15 chest compression. Now you have to imagine that this baby is lying flat on a hard surface, okay? Head in neutral position. And when you do the CPR, you're trying to find the bottom bit of the sternum. You know the sternum is the hard bit of your chest bone. Just at the bottom end of it. And you use 2 fingers, okay? Not the whole palm like in an adult, 2 fingers. And how far you need to go down is probably 1/3 of the height of the chest wall. But easier to say would be probably 4 centimeters that you need to go down. So you go with a rhythm of around 100 to 120 beat per minute, and the easiest way to think about it is following the two songs rhythm. Okay, one is Staying Alive. Okay, the rhythm is just around 100 to 120 beat per minute, or if you don't like that song, you can use another one, Bite the Dust, as well. So these two songs are worth keeping in your mind to see how fast they go. So it's more or less like that kind of rhythm. So you do it for 15 chest compressions. The ratio of giving air to the baby and the compression is slightly different to adult. Adult, as I said earlier on, is 30 to 2, so 30 chest compression and 2 breaths. And in baby is 15 to 2, so you do 15 chest compressions and 2 breaths. So after you've done the 15 chest compressions, you do 2 rescue breaths, do another 15 chest compressions, and then you need to call for help if you are on your own. The slight difference is if you are with someone that can help you, you immediately call for help and then do the CPR. If you're on your own, it's worth doing 1 minute of CPR before you go away and get someone to help you. And to be honest, I think the bottom line is you need to keep doing it until help comes. Okay, so if you don't know how to do the breathing part of it, don't worry, just at least do the chest compression, because it's still better than not doing anything at all. And if you don't know what to do, as I said, just keep on doing the chest compression. If you are familiar with the adult basic life support, but not the pediatric one, just stick with the adult one. So it's 30 compressions to 2 breaths. Just don't stop until help or assistant arrived. But in babies, you need to make sure that if you're on your own and no one else can help you, you do 1 minute CPR as the sequence that I mentioned before you run away to get help. Okay, and I hope that you don't need to do the CPR in any babies at all, because obviously it's quite stressful and traumatic, but at least you've got that at the back of your head, just in case that one day you might need to do anything like that. It might save life, you never know. So if you've got further queries, please don't hesitate to contact your own GPs, or if you want to know more about like, for example, basic life support, especially for babies, you can go to www.resus.org.uk or go to St. John's Ambulance. They've got a lot more information on different kind of first aid treatment for adults and children. So until we meet next time, take care of yourself. Bye bye.